noticed you're at the right time as well. Very good. I always like someone who's on time and not someone who's messing around and wasting my time. Okay, so you're here for the full examination, I see. So we'll go through that as quickly as possible because I have other patients to worry about as well. Okay, so let me just bring this microphone forward. We always have a microphone just to make sure that nothing's going astray or anything like that. Okay, so I will just ask these first questions. They are just general questions, general health questions before we get started into the real stuff. Okay, so I'm just going to give you a brief inspection. Okay, and can you answer these questions for me? So have you had any changes in your speech? Any problems with that? No? Okay. I'm just going to be checking your facial asymmetry, making sure that nothing's astray. It does look good so far, but we'll go more into detail of that later on. Your eyelids, I'm just going to make sure that your eyelids are all in check and not too... Okay, very good. Very good, very good, very good. Your pupils, so can you open nice and wide for me? Nice and wide for me. Okay. A little bit on the small side, but do you take any sort of diluting drops or anything? You do, okay. I'll note that down then. I'll just quickly note that down. And last but not least, for the general questions, have you had any problems with your limbs, anything like that? No, okay, it's all good. Okay, so now we can get into the real deal. We have quite a few nerves to go through, so I'll try and do it as quickly as possible so we can both get going and enjoy the rest of our day. Okay, so have you, first question, have you had any smell change? Okay, only when you've got a blocked nose. Well, obviously that makes sense. There's no need to worry about that then. Okay. Number two, I'm just going to be checking your pupil size, your pupil shape, your pupil symmetry, and assessing your visual acuity with a Snellen chart. Okay, but we're not actually going to do a Snellen chart because I have my own way, which I feel is a better way of doing it. Okay, so I'm just going to check your pupil size and pupil shape. Okay, so can you open nice and wide for me? You don't want me to wear gloves, do you? Okay, it's fine. Okay, very good. Yes, your pupil shape is a little on the low side, but if you are taking dilution drops, that makes sense, so there's no need to worry about that. Okay, pupil symmetry, so I'm just going to make sure that they look the exact same and you're not having, one eye going. That hopefully won't be a problem. It doesn't look like a problem. Doesn't look like a problem. Okay. So I'm now going to check your visual status, where I'm going to just go ahead and write down, well, not write, I'm going to draw a couple shapes and I want you to tell me what they are, okay? So just stand about 2 meters back for me, just like that. Okay, very good. Okay. So can you tell me what these 3 shapes are? What's this one? I know I drew a little bit bad, but what is it? Yeah, rectangle, very good. Triangle and a star, very good. You're a star. Okay, anyway, that's good, so we can cross that off. Now I'm going to be checking your eyelids, your eye movements, and we're going to be using the light as a little procedure to check that your visual status is good again. So I'm going to be checking your eyelids and your eye movements now again. So if you just want to close them up for me, again. Okay. Eye looks look of the right colour, the right branding, if you will. Okay. And have you had any problems with your eyelids? No irritation, anything like that. Okay. And now I'm just going to check going to go ahead and use this pencil that I've been using, along with my light afterwards on my phone. Okay, so can you follow this pencil for me, just from left to right and then up and down? Okay, left and right and then up and down, up and down. Right, and now can you follow my head for me? Okay, very good. Looks all good to me. Now we're just going to be using the light on my phone. It gives me a closer look if there is any problems with your eyes, and we're going to do the same thing by making you follow the movement. Okay, so just give me 1 second, just 1 second. Okay, so I'm just going to look real close into your eyes, so just open them as wide as possible for me. Okay. Okay, and can you close the left one for me and just keep the right one open? Okay, and the same but with the left. Okay, very good. And now I just want you to follow the light for me. Just follow it. Follow the light. Okay. Your eye movement is very good indeed. It's some of the best eye movements I've seen today, to be fair. So very good. Congratulations. Okay, so now I'm just going to be pricking you with this pencil once again, and I just want you to say yes every time I touch you, okay? And do you give me consent to do this? Okay, very good. So just, you might want to close your eyes just in case I, accidentally poke you in the eye, which wouldn't be very good, okay? So, poke. Poke. Yeah, just say yes every time. Poke. 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 Okay. So you said yes 9 times, and that's the magic number, so well done indeed. Okay, so now we're just going to be checking your hearing. So have you had any hearing changes, let's say for like when you're in the swimming pool and you got water in your ear, but just in general, any sort of deafening in one or both ears? No? Okay. And do you clean your ears with wool, to clean out the earwax? Okay. So, I'm just going to now check facial movements. So, this is what I want you to do for me, okay? This is what I want you to do. Smile for me. Okay, just a big smile. Okay. And can you move your sort of wrinkles on your forehead upwards for me? Okay. And last but not least, can you puff out your cheeks? Okay. Doesn't seem like you've got any problems there, which is good, because I've had a couple patients today that have had real issues with those facial movements. Okay, so now we're on to the final stage of the nerves, okay? I'm going to whisper a couple words into both of your ears, and I just want you to repeat them back for me, okay? Nice and simple. So I'm just going to whisper 3 different words into each ear, okay? We'll start with your left. Coconut, chocolate, apples. Coconut, chocolate, apples, okay? And the other one. Coconut, bees, crisps. Coconut, bees, crisps. There you go. Very proud of you. Because I know that can be difficult if you can't, hear me correctly. So, okay, this is a very strange topic, but I have to ask it. Trust me, I ask this to every patient, so you're not getting any sort of weird treatment. Okay, have you had any swallowing issues? And don't make a little joke of it. I'm being serious. Okay, you haven't. Okay, well, we're going to test that theory anyway. So I've got some the right. Okay, just nice and sturdy. And last but not least, I'm going to try and push your shoulders down. So just try and resist that for me. Just try and resist it. Well done. Well, I can now tell you that concludes the examination, the cranial nerve examination. And I'm just going to write a couple more notes down, and then I can summarise it for you. Okay, so just give me a moment. It won't take a couple seconds. Okay, so I'd just like to note that everything looked great except for the pupil size. But if you have been using dilution drops, that makes a lot of sense. So I wouldn't really